Welcome to Usmle World, where we ask, answer, and explain Usmle questions. Today, we're diving into Step 2, Ophthalmology. Let's get started with question number 1. For the following case, which of the following medications was most likely used by this patient? A. Alpha-adrenergic agonist. B. Beta blocker. C. Mast cell stabilizer. D. Nonsteroidal anti-inflammatory drug. E. Prostaglandin analog. The case scenario is: a 62-year-old woman comes to the emergency department due to acute eye pain. She has a history of seasonal allergies and developed itchy, watery, red eyes after working outdoors in her garden. The patient used over-the-counter eye drops to treat her allergy symptoms, and several hours later she began experiencing severe right eye pain and headache. On examination, the right eye appears red with a hazy cornea and dilated pupil that responds poorly to light. Palpation of the globes reveals notable firmness on the right compared to the left. Visual acuity in the affected eye is severely diminished. Tonometry reveals elevated intraocular pressure. The question is: which of the following medications was most likely used by this patient? Your options are: A. Alpha-adrenergic agonist. B. Beta blocker. C. Mast cell stabilizer. D. Nonsteroidal anti-inflammatory drug. E. Prostaglandin analog. You have 15 seconds to type your answer in the comment box. Congratulations if your answer is A, which is alpha-adrenergic agonist. This question is designed with the focus to assess your ability to make a diagnosis. This patient is presenting with angle closure glaucoma that was precipitated by use of over-the-counter eye drops. Angle closure glaucoma typically occurs in patients with a predisposing narrow chamber angle and develops when the normal drainage pathway of aqueous humor becomes blocked. Aqueous humor is produced by the ciliary body and flows from the posterior chamber of the eye through the pupil into the anterior chamber and out of the eye via the trabecular network. In susceptible individuals, dilation of the pupil causes the iris to press against the anterior surface of the lens. This limits flow of aqueous humor through the pupil, causing the iris to bulge forward. The corresponding reduction, or closing, of the iridocorneal angle blocks drainage of aqueous humor through the trabecular meshwork. Acute angle closure glaucoma may be precipitated by topical and systemic medications that cause pupillary dilation, such as alpha-adrenergic agonists, like nafazoline, and drugs with strong anticholinergic effects, like tricyclic antidepressants and antihistamines. Acute blockage results in a rapid rise in intraocular pressure that typically causes severe eye pain, conjunctival injection, and corneal edema, or haziness. If not corrected, the elevated pressure can damage the optic nerve and cause permanent vision impairment. If you choose any option other than A, you are wrong. Let's briefly discuss the other options. Choice B cannot be the answer because topical beta blockers, such as timolol, are used to treat open-angle glaucoma. They work by both reducing the production of aqueous humor and increasing its outflow from the trabecular network. Both, choices C and D, cannot be the answer because topical mast cell stabilizers, like cromolyn, netocromil, and nonsteroidal anti-inflammatory drugs, like ketorolac, are used in the treatment of allergic conjunctivitis, but they are not associated with angle closure glaucoma. Choice E cannot be the answer because prostaglandin analogs such as latanoprost increase aqueous outflow from the trabecular network and are used in the treatment of open-angle glaucoma. Your take-home message from this question is that acute angle closure glaucoma occurs when the space between the cornea and iris is narrowed, limiting the flow of aqueous humor out of the anterior chamber and raising pressure in the eye. Medications that cause pupillary dilation, like alpha-adrenergic agonists and anticholinergics, can trigger acute angle closure glaucoma. Did you get the answer? Proceed to the next question by clicking above only if you've got the answer right. But if you are unable to determine the answer, you really need to watch this episode again. Remember, understanding is the foundation for growth. Unlock the secret to acing your medical exams, especially the Usmle, with our top-notch resources. Ensure you and your friends are well prepared by hitting that like button, sharing this wealth of knowledge, and subscribing to our channel. Remember, your success is just a click away.